Okay, a brief positioning statement on what we believe the future of the pharmaceutical rep is, and then we'll open into discussion. But the reason we wanted, it's so great to be in person, to have you. Thank you for turning up. Going to turn over to you guys as well for questions, and also take some questions from online. Oh, hi, Chris. Good to see you there. So I'm going to take chair's privilege, and I'm going to give my positioning statement. So for those that you don't know me, my name's James Harper. I have vested interest in this topic. I spent 8 years as a primary care and secondary care rep a long, long time ago, at the beginning of the Rep 2.0 sort of period. And also I run a company that specializes in enabling reps through technology and data, so I have a lot of vested interest in the role. So take what I'm about to say with that in mind, but I firmly believe that the role of the medical rep is not only secure, but I think it's going to become more important. I think a scientifically literate, business-savvy, key account manager style rep is going to be pivotal to the customer engagement and the trust and relationships that we need with our HCPs to be successful as an industry. So that is scientifically literate, business-savvy, and technically competent and capable to deliver the right content to the right customer across the right channel. But I've purposely said the role, not all medical reps. So the role has a bright future, but I do fear and feel that the numbers of reps out there will start to decline. And it will be up to those individuals to step up and step into that role and make the most of it. So that's my position, and I will be defending that position through this discussion. And on that note, I'd like to hand over to Rick.
Thanks, James. Hi, everyone. So I'm Rick Hollis. I work at Novartis Oncology as Business Excellence Lead. And I've spent most of my career in specialty medicine and oncology. So that's my sort of reference point, my frame of reference. And so, in answer to your question, no, I don't see this as the end for the pharma rep, but I do see it as the start of a new version of that sales rep. So it's time for a new start, and the reason I say that is because I believe that within data and digital, there are still limitations of what we can't do without a real human being. So it's really complicated to understand in a hospital who's actually prescribing our products. We can see at a hospital level, but we can't see down at an individual customer level. And we can't see their rationale. We also, it's really complicated to understand where the opportunity is, relative opportunity within that hospital. And it's really difficult to understand where the decision-making unit is, who makes the decisions. So within a therapy area, who leads on what disease doesn't exist inside data anyway. You need somebody to understand that. And then finally, it's really complicated to understand the personalities of our customers. And if we're really going to personalize our digital approach, I believe we still need a human to try and really understand those individuals. So I actually see this new role for the sales rep, I call it a digital orchestrator. So their role for me is going to be all about understanding the digital content we have and positioning that best for the customer that's sitting in front of them, or being that triage to get the right digital content in front of our customers. So that's how I see it.
Thank you, Rick. Liv?
Hi everyone, I'm Olivia Nixon. I'm an independent consultant now, and I work with representatives who have previously worked in the field and are transitioning to working in a more hybrid capacity. I've been 20 years in the pharmaceutical industry and have managed remote teams more recently in the last 10 of those years. I firmly believe that this is not the end for the pharmaceutical representative, as I also have a vested interest in their ongoing existence, obviously. But my reason for that is simple. You know, people do buy from people, and I don't think that will change anytime soon. That's just the nature of how the world works. I do think there's a wider conversation to have. I think we need to talk about how we can make our representatives as credible as possible. And this isn't just the reps themselves and their relationship with the customer, it's how the organisation supports that. You know, looking at the marketing messages that we're asking them to give, how much value are they able to give, looking at the call frequency, and how are we enabling them to build those relationships, and what are we accepting as a call? You know, are we looking at every channel, and are we giving the same amount of value to every channel? I also think we need to have a lot of conversations around the mindset of representatives in terms of those that were seeing customers face-to-face that might now engage better over the telephone. And how often are we actually understanding, truly understanding, not just ticking box on a CRM, truly understanding how that customer is going to want to interact with them on an ongoing basis. And that may change from day to day, but we need to be able to capture that. And that's where the technology comes in. You know, there's an awful lot of AI capabilities now that is definitely not my expertise, but, you know, those next best actions are things that representatives need to understand and know how to use and get the best out of them to have that better way of working in the future.
Thank you, Liv. And Adam?
Hi everyone, Adam Boucher from STEM Healthcare. So like James, back in, 20 plus years ago, I was also carrying the bag. So I like to think I can speak with a little bit of experience having done that role. I personally think that the role of the rep will absolutely continue. I think it is definitely evolving and will continue to evolve. I would argue that even without COVID, we would see evolution of the role. And I think COVID and the lockdowns just really acted as a catalyst to speed that whole process up. Clearly, one of the most important aspects, though, is about delivering high levels of value to HCPs. And I think that the role of the rep has a critical part in being able to deliver that value. And I think they do that. And when you speak to doctors, certainly a lot of the feedback, and many of them will say, look, this is my preferred way of receiving information, getting updates. We know that there's been numerous challenges with regards to reductions in spend for medical education and so on and so forth. So many of them see it as a critical way of getting updates as to what's going on, what's new. And I think that's really important when you think about new products, particularly around launches and so on. So I think that in order to evolve, though, ultimately, to provide even more value than they do at the moment, I do think that there's a high degree of kind of customer centricity, personalization, as Rick says, needs to come to the fore. And I think that in order to do that and to build that, the representatives have that local intelligence, that local knowledge, and I think it's really, really important to incorporate that into whatever mechanism or tools you're using to really maximize the value back to the customers. So that's my view.
Thank you, Adam. And finally, the inspiration for my post on LinkedIn about the death of the rep, Mr. Paul Sims, everybody.
Yeah, I'm not used to being called inspirational, but thank you, James. My name is Paul Sims. I founded a company during the pandemic called Impatient Health. Our aim is to make our industry more ambitious and more creative. And I think it would be boring if I just agreed with my colleagues, really, wouldn't it? You've heard lots of positive statements so far. But actually, instead of giving you my position, my personal view, I actually thought I would read a quote to you. I actually had a conversation with somebody who is the UK managing director of a large pharma company just last week. I don't have permission to share their name, unfortunately. But what I will say is that this person spent 3 years pre-COVID building up their headcount in their company by about threefold during the course of their job, and actually managed to, I believe, double their revenues in that same period. So this is somebody who was very much building headcount up until relatively recently. As you can see, his position has changed somewhat. Let me read. I firmly believe we have got enough evidence that most sales rep aren't going to survive. Apart from them all really struggling or going back to work, the efficiency, the return on the investment is nonsense. I firmly believe that our industry has to evolve into a stronger position as a system partner. We need to start developing services beyond the pill that can look at the continuum of diagnosis, treatment, prevention, or adherence, and then ultimately the prevention of secondary events. And that needs and requires a much stronger collaboration with tech firms. And if you look at the deals that my company has done with NHS England, where we've secured a first-line positioning of our drug because we have a more comprehensive value proposition, then we find ourselves in a really good competitive situation. Compare this with the rep, and they're not in the same league. The primary reps, let's be honest, they hardly have any access to GPs anymore. GPs don't even have time to see them. To me, it's even a moral question. Why should a GP see a rep? They should treat the fucking backlog of patients that they've got out there. It's unacceptable for me, and if GPs are whinging about we can't treat all the patients, then yeah, well, see less reps. I quote word for word. So look, I don't have a crystal ball here today, and you've obviously heard what somebody has to say. But what I would warn is that pride typically comes before a fall. And yes, the demise of the rep has been predicted consistently many times over the last 15, 20 years. But we also have to beware the boy who cried wolf. Anyone who's read a famous book called The Innovator's Dilemma by Clayton Christensen will know that there are some very strong signs of when an industry is about to be disrupted. We can look at this very scientifically. The classic story, of course, things like Blockbuster and Netflix. Blockbuster had the chance to buy Netflix when it was only worth $50 million, and they laughed Blockbuster out of the room. It's now worth $130 billion. Why? Because when you're in a convenient place where things to be working, you can't treat other business models with any seriousness. You'd think of them as a joke. Blockbuster was making 20% of its revenues from late fees. And obviously, they looked at Netflix and thought, well, we're going to lose 20% of our revenues. Why the bloody hell would we do that? So it's really, really hard to see what the future brings. But I really think that complacency is an enemy that we have to be really careful of. And even if things don't change tomorrow, we absolutely have to be digging in to try and make sure that we stay on top.
Thank you, Paul. Pretty much what I hoped for. I don't have any quotes with me. I'm not as well read as you. But I think there's a lot to pick out of all of those statements. And even with Paul's statement, we might be thinking about customer centricity. I certainly don't think it's viable to compare market access and positioning within guidelines in terms of day-to-day promotion. And I don't think they're exclusive. I don't think one necessarily precludes the other. If you're in second line, you might well need to step up and speak to your HCPs about why you could be used. But within all of those statements, I think even within Paul's is about thinking about our customers and customer centricity. So I wonder if we could just take a moment, each of us, to think. In fact, let me reframe this. I don't think where my thought came from here is, I'm not sure our industry is complacent. So there's been a big drive that's been accelerated by COVID for omnichannel, data enablement, etc. And I think that is also feeding into how reps interact with customers. To Rick's point, you know, you can have that data, but you still need someone to orchestrate that. We're not at the point where we can do without that person. So I don't know, Rick, if you want to comment on that side of what you said.
Yeah, so I guess what we're talking about is personalization. And how do you personalize your digital content? So I guess if I go back to as the pandemic hit, what we saw was digital versions of what were paper leaf pieces, paper materials, and we just got digital versions of it. And the reps had so little of it, and that was their only way of accessing, they would send those emails to everybody. And that's doing us a disservice. We need to really understand which customer needs to hear which message and how they need to hear it to be able to get it to land. And for me, that's the personalization bit. Is this the decision maker, or is this somebody just within their team? Is that a really patient-focused person who needs to hear it in a patient story? Or would it be better presenting that same stuff as in a chart? And that we should understand that customer better to be able to deliver our content in a way they're going to absorb it better. And
to that point of understanding our customers, we take, Paul, your point for your quote from your contact, your colleague, your friend, your acquaintance, when he said it's a moral question about taking up a GP's time with a rep in front of them. So that goes on the assumption that the rep's not adding value. So when I picked up the bag as I left university with a small amount of debt, a broken down camper van, and a science degree, I did what a lot of people with science degree did, and I became a medical rep. My dad was a GP at the time, and I felt a little embarrassed because almost immediately becoming a rep, you start to pick up this idea that you're somehow a leech on the healthcare system, right? Certainly back then to a degree. And so I was a little unsure about how my father would take the fact that I'd joined the dark side. And he said that actually, for him, he didn't have time to consume all of the scientific materials, and he actually saw the representatives as a valued source of information, but with a pinch of salt. So, you know, as I say, I'm from that era where we were a bit like a scientific walking sandwich board, where we were told what to say and to repeat to GPs, etc. So, to both those statements, that does assume that the rep is adding no value. Is that true? I was open to the panel.
To answer that question. I don't think it's not that the rep is adding value. Obviously, the rep, and I think this can be measured, the rep has added value consistently over the last decades. It's the relative value. When a disruption happens, it's not usually a negative force that drives this. It's a positive force. It's somebody else saying, I reckon there's a better way of doing this. So right now, is there somebody saying, I can be better than a rep? If I can negotiate prices for my drugs and procurement for my drugs centrally through some kind of non-rep solution, that's an opportunity for a pharma company to go, yeah, I'll sell more this way. And that's how it starts. So it's not that the rep is not adding value. It's that it's not that Blockbuster wasn't providing good videos. It's that one day someone else could provide a more convenient solution. And the danger is that, you know, I agree with omnichannel. I ran a session on omnichannel yesterday. Of course, we need to become omnichannel, and there's a lot of mileage still there. But what I don't want us to do is to rearrange deck chairs on the Titanic.
Anyone else like to add to that before I jump in?
So I think as far as my thoughts on that whole adding value piece, I would say it is the responsibility of the whole company in terms of what we're sending representatives out to discuss. I agree with you in terms of the Blockbuster Netflix debate, but I would say that it isn't quite equivalent because Blockbuster was a company and these are human beings interacting with other human beings. And yes, absolutely, there's an argument there are other ways that this can be done, and you know, companies can maximize sales by partnering with tech firms. Totally agree that pharma needs to get better at that, but I don't think that has to eradicate the place for the representative. I just think representatives, I think there will be less of them. I agree with what James said at the start. There'll be an awful lot less of them because they won't need, and neither should we. In, you know, the MD that you spoke to that talked about taking up GP's time, those days in the 90s where we had multiple representatives selling the same product on one territory, all tripping over each other, trying to find something to say to tick a box. You know, let's have the conversation about activity. People are realizing that now, and thankfully, I think we are moving away from that damaging era. What we need to be careful of is going the way of getting email permissions so that we can knock on yet another door of the GP, but this time it's their inbox instead, and it's not personalised. It's because they've been told, the representatives have been told to send out this content to as many of the customers that have given you permission to email them as possible, so they all duly do that, and surprise, surprise, the customers aren't opening the emails. So I think there is, as with everything, there is balance that needs to be introduced, and we just need to look at the bigger picture and what are we aiming to get to with the representative in front of that customer.
And I wonder, when we talk about the medical rep, we haven't really defined that. So for me, a representative is literally anyone who talks to a customer from an organisation. From the MD to the head of medical to an MSL, forgive me, an MSL, yep, they are a representative of the company to customers. A CAM, a rep, a RAD back in the day at Takeda, etc. You know, we might well talk a bit more about RADs in this conversation. So yeah, when I was a rep, there was 3 of us on patch for Lilly, all selling Prozac in different positions. And I had a number of HCPs, or GPs as we called them back then, saying, if I see another of you telling me about Prozac, I'm going to flip my lid. Right? And I didn't even know my colleague had been in the week before because we didn't have the technology to track it. I am from the carbon copy paper days. You know, I used to submit mine in the post and I get a 3.5-inch floppy disk back in the post with an Excel spreadsheet on. I mean, that's why I'm so excited about technology and data-enabled reps, because we can be more customer-centric. We can see appropriately so that we're not just knocking on doors and flogging something to someone who is not even interested in it. We can use technology and data and omnichannel and customer centricity to make sure we are adding value. And I don't think what we're talking about here is exclusive. I think, obviously every pharma company wants to get that deal. They want to be in primary position when it comes to the NICE guidelines. But even if you are, you still then have to promote those guidelines to clinicians. They don't automatically absorb what goes on from NICE, etc. So that's why I feel there'll always be that role. But we do have a moral obligation not to waste clinicians' time. And I think technology, data, better trained reps will enable us to do that.
Yeah, so I totally agree. I think if customers at the moment, and perhaps this is varied based on geography and different customer types and so on, but if customers up until this point have found representatives of value, imagine the potential value that they will realize if we do properly arm representatives with all of the data, the analytics, the better understanding the needs, the better understanding the preferences, the better understanding of what customers want, when they want it, where they want it, how they want to consume it. And hand in hand with that, we provide them with more modular, snackable, I think is the term that's commonly used, content that can be much more flexible. If you think about, I'm sure you were the same, James, when I was a rep, and I'm sure if there's reps on the call as well, you're going out, you're talking about your product, and that campaign sometimes will run for some amount of time. And to have new things to talk about with your customers is really important. It's important for you because as a representative, that's very energizing. But also I think for customers, they want new, they want fresh. They don't want the same detail aid day in, day out. They don't want the same messages or this, a very static kind of set of data. They want something which is much more flexible and is based upon what they're interested in, whether that be different case studies each time you visit or different ways of looking at different cuts of the data or populations and so on. So I think companies have also got to provide representatives with that range of content so as they can really make the most of the opportunities that they have.
100%. And I think there's a challenge here, which is if you're a new product launch or in a specialty area where there's lots of research to share, you've got that, I want to say a luxury, but that you've got that new data coming out, HCPs are really keen to learn. But what about products that are towards the end of their life cycle? So I think a lot of people talking about it's moving from a CAML representative role to more of a customer service, alluding to what you were talking about being part of that solution where you're talking about access and services rather than scientific data and information. I don't know if anyone comment on that in terms of how. Okay, let's make it more controversial. Do we need reps for a product that's post-launch? This significantly post-launch.
Sorry, Paul. Yeah, so that's something we think about quite a bit actually, and I'm a firm believer that not all drugs at all points in their life cycle will need reps. And so I think different products go into very different markets. So some are quite unique in market and they're quite rare diseases, small patient populations. And the people treating those diseases tend to be quite a tight community of healthcare professionals and they all talk to each other. At that point, having a field sales force probably isn't needed. And then likewise, in a life cycle, I believe that to get off to a good launch, you might want, you've got to build your relationships and you've got to build your engagement in that community. But later on, I would think that quite a lot of drugs are on a trajectory and actually the requirement for field promotion probably drops off, and it's then about how you manage those patients. Because let's face it, if there's no new data points coming, there's no new license indications, the data is the data. It's then about actually how you manage those patients on that treatment. That's a really important part for the reps, but you probably don't need as many to be able to do that.
Yeah, I was 4 years post-launch of Prozac when I picked it up and was promoting it. I had a 5-page detail aid with a number on the back. If I lost it, I was out of a job. And I had 5 pages to sell on, and it was the same 5 pages for every customer in every call. And there was a detail aid follow-up phone call that used to happen, and they'd check on my sales messages. As I say, it's kind of like a walking sandwich board with a bit of a science background. In fact, I was listening to a podcast from Atrixia, a consultancy, and this chap who's called Chris Guy, had a quite good analogy. He talked about Reps 1.0, 1950s through to late 80s, early 90s, where it was relationships. It was golf, quite honestly. It was golf and meals and relationships, and we moved away from that to and I was at the cusp of that. I was in territory as we were no longer allowed to rent hotel rooms that had a golf course attached in case, I don't know, the doctors snuck out the back door and got around the golf in between the talks. And that's kind of 2.0, where, as I say, we were kind of these walking advertisements, but with a scientific background. It was great when we had new data. It was really exciting. I remember the olanzapine trial I had for schizophrenia, HCAJ. I even remember it, 1,300 patients. It was really good stuff to take out there. And I had doctors calling me to get appointments. Right? So that's 2.0. And I wonder if 3.0, which is what Chris was talking about, is the best of kind of those both worlds. To Rick's point, that you've got to understand your customers, you've got to build a relationship. But to Paul's point and everyone else's point, having that scientific information. So it does talk to, can you have a Rep 3.0 that's just one part of that, the relationship, and not the new information and scientific value? Maybe that's the field forces that we're going to start to see decline.
Yeah, and I would say the corollary to that is the rise of medical affairs. Still, medical and commercial don't seem to be able to sit around a table and have a cordial conversation.
Allowed to.
And actually, James, as you often say, medical are company representatives. They should be not necessarily selling or promoting, but they should have a return on investment.
Creating an environment in which appropriate prescribing can happen.
There we go. Beautifully put.
Selling.
So to me, it's amazing how long it's taking for medical affairs to take the forefront, and everyone is starting to say that the trust driver is medical affairs, the customer experience is generated. I can't understand why this is a new phenomenon. Like, there's a few people who were saying this 5 years ago.
I'm not sure it's new phenomenon, but there's just not enough of them, really, and the expense that's involved around MSLs is, talk about ROI. I'd like to really see some ROI on that. It's a question we haven't asked, and I know questions come up from the audience. We did talk about, has there ever been strong evidence for return on investment for field teams? And it's a difficult one, right? It's a really difficult one. I can see, you got a question you want to ask? No? Okay,
just reacting in shock.
Just reacting in shock. It's a challenge, and I know that, Rick, you have a point of view on that through your team.
Yeah, so talking about the old days, I've done a lot of field visits with reps through my career, right? And I've been to too many low-value lunch meetings, stand meetings, where we've both travelled across the country and we've gone and bought sandwiches in Tesco's, and then we've done a presentation, and through no fault of their own, the rep is widely ignored, and actually there's a lot more interest in the sandwiches. And that's not doing anybody any good. So let's stop measuring it, because I believe reps will give us what you ask of them. Like, if you measure the number of doctors that they see today, they'll see as many doctors as they can, because they'll deliver on that measure. So we did some analysis recently, and we looked at over 2 years worth of customer engagement data across 10 different teams, over 100 reps, and we looked for all the different customer engagement that we do, right? So face-to-face, coverage and frequency, call rates, email opens, website visits. We looked at everything we did, and only one thing correlated with sales growth. And that was when you had a target customer in a priority account in a one-to-one interaction that used sales materials. If you get that can change prescribing behaviors, and that's what we're looking to do, shift people's behavior. So if we measure that more and ignore the volume and the numbers, then I think we'll get more quality, and that's where we add value.
Okay, so measuring value is really important, right? So we talked about is, are we as an industry genuinely adding value to our customers? And then can we measure that value? So not just call rate. I will freely admit, when I was a rep, that the place where I knew I'd get all the prescriptions but couldn't access, which is the central practice in rugby, where I only got one appointment a year and you had to queue up for 6 in the morning till about 9 in the morning to get in the book, and you get that one appointment. I couldn't shift that doctor's opinion in one appointment a year, right? But I knew that's where I needed to be. But when I was called out on my call rate being too low, where would I go? I'd head up to Nuneaton, where there was a row of 4 offices next door to each other, each an independent GP, and I could get in there with a pack of sticky pads and some free samples. And I saw those doctors 12 to 14 times a year, and I probably didn't get one script out of them because they saw every other rep on the patch. So what we incentivize will get. I would challenge that I've also seen data on sales aid usage where I'm pretty sure the reps are sitting in a car and working through it, right? Because you get the same cadence on all the slides. So it's also about winning hearts and minds and believing. So you talk about those sandwich lunch meetings, the ones I hated doing, where you just, you're walking through the same supermarket and everyone look at you with pity as you're piling up sandwiches, and you knew you weren't having an impact, but you felt you had to do it. So it's not only do I not feel valued, I'm not adding value as well. And we might, just be feeding the NHS rather than adding value to the NHS.
Yeah, I completely agree with that. I sold an antidepressant for 8 years, a branded antidepressant from 2002 to 2010, hugely saturated market in Manchester, and most of my territory was South Manchester. It was really tough access. And it was all activity in those days, activity. But the doctors in South Manchester that were really hard to see, that just like you're saying, one a year if you can get in there. They were worth seeing because you'd get a good call with them and you could go through all your clinical information because you didn't see them all the time. You actually had something of value to say. We did get one independent study. We were very proud of that in that one time in those 8 years. But when I had to get my activity up, which was always the case because it was such a tough territory, I'd head to central Manchester and sit in the same surgery alongside 4 or 5 other representatives, just waiting for my turn to have 30 seconds in front of someone who probably wasn't even going to stop writing his prescriptions out. That's just what he did. And he did it to tick his box, thinking he was doing me a favour. And yeah, I suppose he was, because I was able to tick a box. But it didn't do, I didn't feel valuable. I didn't get anything out of that in those days. I didn't feel that I was contributing anything. And that's, I think if you're talking about the future for the representative, I think this whole discussion, yes, it's, times of change are always going to be scary and people feel vulnerable, but actually something good can come out of it. If we can look at that relationship that we have with the NHS and really address, are we bringing value? Am I doing something good? We all want to do something good. You want to feel that you're contributing something good to the world. Nobody wants to tick a box to talk about how many calls I've made in a day. It's not about that. It's about what good have you done today? Values and mission statements in big pharma, unfortunately. I've sat in a room where not one person in the room could tell you what the values of the company were. It was just corporate bullshit. But actually, make it real. Make it matter. Make the representatives actually feel like they are doing some good and partnering with specific customers in the NHS.
Liv, I've just realised I think I was a competitor rep to you in the early 2000s in South Manchester.
Really?
Yeah. I was the one sitting in central Manchester.
I think you look quite familiar.
Going to keep you two apart.
But I was sitting here listening to you and thinking back to Paul's comment about blockbusters and Netflix. And if there's a company in California somewhere trying to work out there's a better way to promote medicines, right, they're probably not going to recruit a load of sales reps to do it. Right? So I understand that the model is going to be different, but at the same time, I think our customers are looking for it to be different as well, right? They're a lot more choosy about what they do with their time. They have to be. They're a lot busier. I spoke to one of our reps last week, and he was, so he's been in hematology and oncology for decades, right? Excellent relationships. And he said post-COVID, he estimates that somewhere between 50 and 60% of the customers he could see pre-COVID, he can see now. So that gives you almost a half of drop-off of customers that used to arrange to see him that don't do it now, right? So you just look at the numbers in the UK, particularly in the UK, France, Italy, they're all bouncing back, Germany. But in the UK, the numbers are declining, right? And they have been for a while, and they continue to come down.
I was going to say, in the Viva report, which was the global report that people have read, the UK was singled out as being particularly bad.
And in there, it says 75% of doctors want the same or more digital interactions. Now, what they don't say is it's digital only. It's that mix of face-to-face, person, and digital.
And we need to assess the impact of each of those different touch points, right? So I don't know if anyone is familiar with Across Health and what they do with their benchmarking data. So it's called Navigator, and they treat a rep one-to-one with an HCP as an MCQ score of 1, and then they evaluate the other touch points and give it a weighting, if you like, with a head office email being 0.1, a rep-triggered email being 0.2 or something like that. And it varies by country, by geography, by territory, by specialty, etc. But I believe this is where we need to get to, this level of insights and the value add in order for us to target our activities effectively and not paint ourselves into the corner that the 2.0 era of reps might have done, which is, why am I seeing this rep? And I had that a lot.
You asked a question about 10 minutes ago, James, which was, should a mature product have, and there has been clear evidence that having a sales oomph, I think Entresto with Novartis is another clear example of something that was doing badly at launch, and actually the curve, they was able to create an uplift in the curve, so there's definitely some value, but ultimately you've got to ask the question, what is the future sales rep's job? What are they there to do? And the job to be done doesn't change very often, and that's why it's always good to look at sort of what your big purpose is rather than your everyday tactics. But I would argue that this is a moment where the job to be done is actually changing. I stood on a stage recently and I asked a question to the audience, and I said, everyone had sort of keypads so they could vote, and I said, will the primary job of the sales rep in 5 years' time still be selling? Will the job of the primary sales rep still be selling? And interestingly, 91% of that audience, and it was a commercial pharma audience, said no. There was one thing that I just told you that was incorrect in that story. I said recently I stood on stage. That stage was 5.5 years ago, okay? And I asked them 5 years hence. So we're now at the time where they said that would happen. So the writing has been on the wall for bloody ages. The pandemic was a catalyst, as Adam mentioned earlier, and yet still I feel that we are a long way away from where we could and should be in terms of redefining that role. And I think that the rep should be much more about listening than talking going forward.
Okay, I've got quite strong views on this, which is the listening is a means to selling, right? At the end of the day, if we don't sell and we don't move product, we don't get paid, the shareholders don't get it, and we don't do the R&D. And I mean, at the end of the day, however much you want to dress it up, it's why I get slightly frustrated on the medical side of things. At the end of the day, we're selling product, we're moving stuff. Right, and to dress it up as anything else, I think, is disingenuous.
That's true, James. I'm going to interrupt. Sorry, but how are you selling?
Oh, that's different.
Yeah,
right? How
exactly.
selling? So the job to do for the customer is different to the job I'm doing for the company, right? And the job I do for the customer should be aligned to supporting the promotion of that product. But that does mean less patients through my door because they're being treated effectively, less readmissions, and the job to be done is to help the doctor do their job. But the job the rep is paid to do is to sell drug. I think I hear a lot of people talk about it's about improving patient. Yes, ultimately, but at the end of the day, a lot of us are here in the commercial sector to push that drug. You've got to believe it, of course, is there for the good of the patient. But our day-to-day role when we're out repping is to sell. Yes, we've got a question in the audience. Do you want to?
Well, if you can hear me, I don't need the microphone. I just wanted to make a comment on this conversation just hit right now. I set up a creative agency in pharma 3 years ago, just before a pandemic. We started trading about 2.5 years ago, right before lockdown. And obviously we went through a load of panic from our clients and all that kind of stuff, how we're going to see more customers and everything, but that's by the by, that's just setting the scene. Interestingly, all we've done for the last 2.5 years is either work in rare disease education within rare disease, or oncology, or hematology in small patient numbers. Now I'm not trying to boast about what I've done 2.5 years ago, it's been a very hard journey, but what I'm seeing is that when we start, say for instance, we did a disease awareness campaign in a rare disease. Now won't say which one it is. When we started doing this disease awareness campaign in rare disease, at the start of the point where we're doing it globally, the facts of diagnosis, who does the diagnosis globally, were completely different to a year later. So, for example, when we started doing disease awareness, the aim of the campaign was to get most other specialities to refer to haematologists for diagnosis and prescribing of this particular treatment. And we were told at the time it was 1 in 2 million patients that get this disease. A year later, what we're finding, I found a couple of things, because having worked in it globally, I went to UK conferences and did my own research. What I found was, from a UK perspective, it's not haematologists that are diagnosing it, it's actually rheumatology registrars, because of ICU and they're around and they come down and now they're using their diagnostic capability to get consultant jobs. And secondly, there was a professor in Bristol with 5 potential patients of this particular disease a year later. So if this guy in Bristol has 5 patients, then obviously it's not 1 in 2 million unless someone's poisoned.
Yeah, sorry, I'm conscious that the people online probably can't hear you, so is there a question? Yeah, if you bring it to it.
Sorry, I don't mean to make a massive speech here. But the point I'm making by setting that scene is that when you go back to talking about selling, listening, and supporting, actually it's a longer sales process, isn't it? The rep has to figure out, actually, is it true that this is this many patients, or the marketeer or the agency, whoever it is, and actually probably follow avenues of investigation that take a long time before they can actually sell anything. So what I'm saying is, I guess I agree with everything you're saying about listening and actually building up that picture. And I'm finding with all our clients, all the work we're doing, it's actually putting people on that journey of discovery of who's got this disease, who's making the diagnosis of this disease, and then who's prescribing it. It's just an observation, really.
I totally agree. I don't think the two things are exclusive, right? If you look at, we observe as part of our model like thousands of calls a year. Thousands. We sit in the room and we observe those calls. And typically what you will see is that the best calls are typically one where you've got a really good, balanced, two-way dialogue, and you'll have a lot of questions, a huge amount of questions. So the representative will be listening, of course, and trying to understand what's going on, what are the views of the physician, what are their beliefs, what are their preferences, all those kinds of things, tailoring the messages and so on to those needs. But there is an enormous amount of a good balance of that, customer share of voice. They're really understanding a lot more about what the customer thinks, and typically as a result of that, those are more successful calls. That's what we see all the time.
And I think it's not just the calls that are, so it's a more complex environment than it probably ever has been, right? In terms of other regulators in the space, guidelines. We're moving to rare diseases. Similar to you, most of our work is in the SMB and rare diseases space. It's where the most activity is, and it's where the most complex sell is. And that's where MSLs and market access are key, because without them laying that groundwork, finding out what the clinical pathway is, working out who the key stakeholders are, and it's why a CAM is more appropriate often than a rep, because you need to understand how that whole key account works together and the pieces you need to move. But at the end of the day, all of that is down to, can we, get that product used in that key account?
So I guess, what I'm hearing is it's different in different disease areas, different therapy areas, right? Very different. But I really like Paul's point about it's more about listening than it is about selling, because I think what we're hearing is that complexity. I guess in my opening statement, that's what I was getting at, is that it's complex, and so we need that the human being to do a lot of that understanding and listening. And in my simple brain, the way I think about it is that nowadays the selling doesn't stop when the rep leaves the room. It used to stop then, but now it doesn't need to. So yes, the rep might do listening, might do selling, but it doesn't have to stop when he leaves.
True. Let me make it clear, I think you need to listen to sell. I think it's all part of the same process. It's not like you listen and then don't close the business. Like, so I think we may be thinking selling is just bashing the door until they say yes. Like, it's always been
That's 'cause that's what
an
pharma
emotive two-way dialogue.
Is that not how it works?
Okay, we have, it does some cases, you know, how many sandwiches you bring, all the rest of it. I'm conscious we haven't really gone to the audience. I don't know if you have any rebuttals or anything like that, but we got questions.
Not always, but
Yeah, we got the mic, Ben. We can just bring that down so that people online can hear. At the front here.
Just while the microphone's going, I'll say that this agility thing that we're all obsessed about, that depends on being able to listen to customers. So it absolutely has to be part of the process.
I think listening to everyone, it's quite interesting because
I think that's not on. You just need to press and hold the red button so it goes on. We keep hold it down.
Is it on now? Yes.
Yes.
I suppose I see it fairly simply. Everyone's gets hung up on terminology, hung up about functional departments. Fundamentally, though, the whole industry and all the support industry around it is trying to change behaviour. That's absolutely what we're about. And there are numerous ways to change behaviour. And I guess the rep is one part, the face-to-face interaction is one part of the omni-channel mix. And the customer has to be at the centre of that omni-channel mix. And for me, there's a lot of conversation about personalisation, but it's personalisation that we talk about from the industry's perspective, which is what's the next message we want to send, what's the next best channel to use. Actually, personalisation is about giving choice to the HCP to decide how and what they want to engage with to deliver the information they see of value and trust to deliver a change in behaviour. And I guess that's sort of a high level overview. It's hugely complex, but I think sometimes we just need to back away from some of the complexity and bring it back to some of the simplicity in my thinking.
That's a good point. Looks like
I 100% agree with that. The question back to you, what role do you think, though, that the reps have in terms of understanding what that customer wants? Because I would say that is a fundamental part of why reps are still going to be important. They have that knowledge, they have those really embedded relationships that take time to come to fruition and to get that kind of understanding. Do you feel that they still have a big role in terms of helping companies understand what those customers want so they can be more personalised and customer-centric?
Yeah, absolutely. I think... Is this still on?
Yeah.
Fundamentally, yes, they still have a role. They are one of the conduits of information back into an organisation. Everyone measures everything from an omni-channel perspective. So organisations are absolutely awash with data. And I think trying to identify, what's the best way? Trying to identify actions, decisions based on that data is complex. You know, Rick referenced a huge investigation at Novartis, and it's interesting to find the result that you found. But, you know, yes, reps have got a part to play, but they're not the only part. And the customer, the healthcare practitioner, should choose or be allowed to choose which part they want to engage with, at what time, and for what information. And I 100% agree with you, Rick. The doctor does not see a difference between the people that are in front of them. Every single person they see from a company is a company representative.
Yeah. So I really love that conversation, actually, and the bit about the value that the rep brings is the face-to-face bit, right? That one-to-one. And when I say face-to-face, I mean one-to-one. It doesn't matter for me whether it happens virtually or face-to-face, but it's the one-to-one interaction. So that's the value you need to measure of the rep, but that's not the entirety, right? So it's all digital. The only bit I'd add to your conversation there that you were having is, I think we need to understand what the customer wants, but I also think we need to understand where we are trying to get that customer to. And I don't think our industry uses adoption ladders very well to understand where we're trying to get them to, because then it's about matching what the customer wants with what the behaviour is we're trying to change. And I think that's the bit we miss sometimes.
Working in the CRM field, very familiar with adoption ladders, and they're usually 1, 2, 3, 4. I reckon if I got to see any rep in that field team and said, what's a 2? You know, what behaviours are associated with a 2, they wouldn't be able to tell me. I want to pick up on a point you made there, which is the reps are a small part of omnichannel. I think they're one of the most important and biggest part of omnichannel. And the reason I say that is, back in the day, like I was doing those carbon copy and I was using a Filofax to keep my notes. And actually once I pulled out of a GP surgery with my Filofax on the roof and it flew off underneath a bus in a puddle. And I lost all my appointments and most of my insights, right? With a good CRM, with good functional content, in that one-to-one setting where the rep is, or the MSL or the CAM is understanding that customer, we need to capture as much of that as we can to the CRM, because it's the foundation of good omnichannel engagement going forward. Like a customer's not going to give up their clinical pathway to a banner ad, but they will do as part of an in-depth discussion with a good rep, right? And that's valuable not just to the company, but to the doctor, because it means we can add that value and not waste their time by turning up next time and not knowing what it was we talked about the time before. I feel like I'm getting on a soapbox, so I'm going to step off. You got a question from the audience? Yes, please. Yeah. And then we'll go for Chris.
Thanks. Hi panel. Lisa McCurdy from STEM Healthcare. Until a year and a half ago, I was in the industry for 20 odd years. My question's around measurement. So I think I'm hearing a lot of alignment around Pharma Rep 3.0, and a lot of the meetings like this, we're saying the same sort of things. However, for the past 20 odd years, those measures from our global big pharma, the ones who ask for the dashboards to be completed, are always around. There's always share of voice, there's always call rates, there's always those metrics, and they haven't really evolved, just got better at evolving them more accurately. What do you see? What do your panel see? When do you think we'll move away from that as a way of measuring the effectiveness of our reps, and what would replace it? What would it take for the global pharma head offices to start looking at things differently?
I think it's really, really sad that it hasn't evolved as much as it has. And when I said we need to listen more, I think it's because we actually need to be partners or co-creators with our customers. And the art of storytelling, the art of creation, all of these things I think have been lost in our commercial organizations in so many ways, particularly when you have the sort of rigidity that you spoke about, being phoned up to ask if you got those 5 messages across. Geez, like there's clearly no trust within your own company, let alone...
You know, next to the phone with the 5 messages on and say that I would bring extra vessel sandwiches if they repeated them down the phone.
I think the only way for reps to survive and thrive is to be more entrepreneurial, and thus to have much more high-level targets and associated with their name. I just mentioned the word agility. The only way that agility can ever work is if the person who is interacting on the front line has the ability to gather and to pivot according to what they actually hear, to actually change, and to be able to use those ears to actually change something internally. Otherwise, it's a total and utter waste of time. So, yes.
I agree completely with I think the whole industry set up not to trust the rep to do the right thing, either through rigidity and the code. I always used to, the code is all designed as though the rep's just desperate to break it, right? It's desperate to do the wrong thing. And actually 99.9% of reps want to do the right thing. So that trust and that ability to have higher responsibility. But what about just asking the doctor if we've added value? Yeah. Right? So NPS scores, we're all used to those. And I've often asked clients, would you like to run them at the end of an engagement? And we tend to do that at the end of webinars. We tend to do it at the end of digital. But there seems to be a fear to do it in front of, with the customer after a call. But obviously STEM is your business, right? To measure and do that. What's the future looking like for you?
100%, but I do think there's, you see in, for example, market research, quite often questions will be asked of of physicians about the value of that company or, that particular role and how that compares to others and so on and so forth. So I think that I can imagine a situation in the future where some of those aspects about how much value was, how valuable was this interaction to you, I can imagine a situation where those do become perhaps something which is built into representatives' targets. You know, are you progressing? Are you progressing? You know, the views and how you're perceived, or how we as a company are perceived over time. Are we becoming more valuable? I mean, throughout the lockdown period, there was a number of different surveys that were done by different companies and providers looking at, well, what is it that you as HCPs find valuable? What is it you want for the future? So companies are desperate to understand and have sought the views from physicians about what they find valuable. And it seems then only right that they would want to then build that into their future value proposition in some way and measure if they're actually delivering on that.
I love the way the conversation has shifted slightly from focusing on what the reps need to do to what the brand teams need to do, the marketing teams, right? I don't think this is all the fault of the reps. I think they're hugely underserved. And so to Lisa's question there around, you know, what's stopping it, I think we've got this whole structure and this history of leadership, commercial leadership in our organizations that are used to counting coverage and frequency, share of voice, right? And so they ask that of the sales reps, so that's what the sales reps give them. And yet our brand team, I would encourage any sales reps listening to really get specific scenarios of customers that they're speaking to and go back to the brand teams and say, what's the content for this guy? Yeah. What should I be sharing with this doctor? And really challenge, identify the gaps in your digital content and ask for more content.
So something we've been seen happening and encouraging is if you plot your adoption ladder and then your customer segmentation, and then you put in, you'd be surprised how much content already exists, probably enough, in different places hidden around, and you plot it against that and you go, oh, there's a gap here. And then how do you win the hearts and minds of the reps to understand that the right content at the right time will move the customer, and how do they find it, how do they measure it, how do you evaluate it, and then you can iterate and improve it. You've got to start somewhere with a guess. I think this content will work with X. And then it evolves in time. And that's why I'm so excited by technology and data. It's why I refocused our whole company away from anything digital to just sort of rep technology and data, because it comes back to the point that you made right at the beginning, Paul, in your statement, which is, do we have a moral right to waste the time of our HCPs, right? It's a moral question, right? And technology, data, and motivated and enabled teams will go out there and add value. But if we just measure them on how many doctors you've seen, how frequently, etc., then that's what they'll go out and do, despite even their best efforts or intentions.
That's an excellent point.
I think we have a question from Chris.
Hi, so Chris Bartley from Lucid Group. Just picking up on the metrics question and something Rick said. So Rick said the critical thing that they'd found in their research was engaging priority target customers. So if the metric became 100% attributable touch points with customers in the target list in the last month, what would be the most effective way to deliver that? It's almost certainly going to be field force. It's almost certainly going to be traditional old-fashioned sales force, because MSLs are by request. So to drive a specific target list engagement, it's probably very traditional reps. It is probably also traditional peer-to-peer activities. It would be extremely difficult through digital-only activities. I just think that's an interesting observation based on what you sort of defined, Rick, as what might be a very important metric of 100% attributable target list engagements in the last month.
Yeah, it does. Yeah, it's a big assumption, right? So getting the targeting right is important. I guess what we were talking about there is what we should measure the reps on. So it starts with the assumption we're just talking about reps there. So it's not talking about what we measure outside of that, I guess. For me, I think looking at the effect... Sorry, Chris. Couldn't we measure everything by that same metric?
So if you measured everything by 100% attributable target list engagements in the last month, why not measure every channel by that same standard? Yeah. And then you could assess very accurately where those critical engagements that you identified were taking place, how frequently, and you'd understand what not to get rid of or what to amplify.
Yeah, I really like that. So essentially, I think what you're saying is, rather than a sort of shotgun approach of just shoving noise out there to every customer, what we're talking about is laser focus and identifying these are the actual people we need to speak to, and then really focusing on that across all channels. I 100% agree with that. To get the target list right, we have to have people out there to understand who those individuals are, though, because that doesn't exist in data.
But this may be the first time in our industry where we can not only, not in the past, it's like, who are our targets, where are our potential, who are we going to go and see? But we haven't had the ability to see if what we're doing with them is actually moving the needle, right? So we'll go, here's our high priority targets, we'll get out there and we'll do what we're saying. It's the first time we can start to see that and reevaluate our target list on a minute by minute basis, maybe not minute by minute. So again, through technology, I think it will start to show there's an awful lot of doctors we shouldn't see. Also, do we have any questions online? There's not any stacking up. We do. Okay, so let's, big stack of questions. Let's remember we have an online audience.
Hi, sorry. Actually, it was interesting just hearing the points around the room. We were talking about reps making a difference, and then we were talking about brand managers helping make reps make a difference, and then we established that a rep is actually defined as a representative of the company regardless of role. Actually, one thing that we probably need to consider is, are we measuring the teamwork between different representatives of companies in order to move that adoption ladder forward? I mean, if we think about how complicated selling a modern pharmaceutical is, it's usually quite biologically complicated and probably requires a number of sources of information to move people along. Can we actually measure the collaboration it may take? So say, for instance, if you're a key account manager, you identify who the key person is that you should be talking to in an organization. You have that conversation, but actually it's going to require different sets of information from different parts of that company. Actually, do we need to start measuring collaboration within a company in order to move that?
Definitely, and we are in some cases. So, within a key account managing planning software, you can have multiple users within that key account that they're using the planning. You have responsibilities for certain activities, and you can see they're working. I'd like to even take it further up than the field-based team, is the weird separation of church and state we have in our industry, which is, why are marketing and sales so damn separate, right? Why are they even separate functions? If we put the customer at the middle or in the center, then there's almost no such thing as marketing and then sales over here. It's about how we engage them across all these different touch points. And I like your point, Chris, if we can measure all of those and we treat them in the same, it goes back to that weighting thing we were talking about with across health and MCQ scores, etc. But it takes much closer working between the marketing or the brand teams and the sales teams than we've ever seen before. So I was conscious about the online questions. Ben, are you going to ask on behalf? Thank you.
Yeah. So the first question is, do you not agree that if a high percentage of HCPs do not want to see reps, the role is at serious risk, particularly when there are other channels easily accessible to provide the information required?
So yeah, I think that the role's not at risk, but the number of people in that role.
So if a high percentage of HCPs do not want to see reps, that the role is therefore at serious risk.
So I don't think the role is. I think the numbers of people in that role, and I also think, why would we want to see the HCPs that don't want to see us? Like, it's always been an odd question, and it's almost self-serving. You can't get in to see those. Right? They're seeing you for some reason.
I'd agree. I think what we have to do is have valuable content positioned where those doctors are and let them come to us, right? So it's less push, it's more pull, and we're at the congresses or we're in the digital spaces they see the valuable content and they come to us.
And is it any surprise when you're measuring share of voice still? If reps are zombies, then are we bloody surprised that they don't want to be seen? I think, again, it's down to the rep, it's down to the individual to be able to reinvent themselves, not to fear, but to embrace the future and understand what the future of our industry is going to be and become more valuable and open more doors.
I would challenge that slightly. It's not just the rep, it's down to the organisation and the culture
everybody
that they work within, because they can only do so much.
So there's a challenge to that question, who on this panel would choose to be a medical rep again at the start of their career? Like currently, like I actually probably would.
I would.
But for the right company,
Yeah.
right?
Yeah, that's what I was going to say.
So that
it
the right
depends on
company-
exactly what you just said.
I think it'd be really exciting to have this technology and data and to be working in rare diseases or in the oncology space. I think what a challenge that would be. But the rep I was before, nah.
Yeah, same.
Do we have another one from online?
Yep. So second question's from Rena, and she wants to hear what your views are on the future dual role of MSLs who can promote with no need for traditional reps, or whether there's no need for MSLs in the future.
MSLs that can promote, are they allowed to? Doesn't like,
So it's not like
don't they
a
burn
contradiction.
or something?
Yeah, I think that's...
Did they burn?
I think so.
Okay. I was wondering what would happen.
Yeah, if they ask for a prescription, don't they just automatically? I don't know.
So I think, there's a complexity in that question where it sort of contradicts itself, because my understanding is that role. So an MSL, a medical person, can proactively have a list of target customers, so they can have a list of customers they want to get to. That's perfectly allowed. So if it was an advance notification, for example, that they're going to go and do about a new product, they can have a list of customers they want to go and talk to about that. And you can measure their coverage of that list of customers. That's perfectly allowed, right? And you can also then proactively do some disease awareness stuff, right? And the MSL could proactively put on disease awareness events. So there is some stuff MSLs can do proactively, but they can't promote. So when we talk about the objective of a sales rep is to change behavior, that's not the objective of an MSL, in my understanding.
No, in fact, I was asked to do a presentation a while back to the medical communications community, so less creative, more scientific, and what can CRM and CLM do in that space. And I had to go and look up what the role of an MSL was, and I think the best one I found was the United States College of Medical Science Liaison Managers, and there was a big charter of all the things they did, and the one that jumped out for me is to inform the commercial. Right, so what they can do is they can understand the market, the clinical pathways, who the referrers are, and that can inform the direction the commercial can take. And that's about as close, in my understanding, you can get the sort of commercial link with them. But I think it goes back to, we're all saying this. When I set this, I was initially going to do a debate and then realised there wasn't enough disagreement for a full debate. And I'm not sure any one of us wants to stand fully on one side or the other. It's more of a panel discussion, as you're seeing. All of our Venn diagrams overlap more than they don't. And I think we're all coming down to, it's a coordinated approach. It is MSL, it's been like this for years. MSLs, market access, CAMs, reps, RADs, whatever it might be, working together. Never have we been in a better position to use data and to use technology to coordinate appropriately together, putting the customer in the middle. But one of those people needs to be the orchestrator, needs to Rick's point right at the beginning, you still need a human to fully understand the nuances of a key account, the nuances of an individual and their preferences. So I think is still the rep that sits in that middle, and that's why I'm excited that they're going to become more senior, more valued, more critical, more empowered, but probably fewer.
I have to just comment, I think for me, just hearing what we're talking about, I think the role of the MSL does possibly hinder slightly the relationship that representatives have with their customers. If you look at that whole credibility piece and how the representative can be seen to bring value, and yet ship you out and bring in an MSL who's not going to try and flog me anything, but that, and they can have a different relationship. It's a good point,
but like again, a well-coordinated team, it can be an advantage. And again, it might be the hearts and minds of the representative and their understanding of the MSL role. Even before MSLs, when I was selling for Lilly, we used to bring other reps in and pretend they were the expert to have more weight than I had. So they would come and do the presentation, and it was just another rep from another territory, but it had a different feel to it compared to the guy that they see all the time. Was that allowed?
I don't think that's a good idea.
Is it?
No,
It's not a good idea? It was long enough ago.
I think I saw that on Dope Sick actually as well.
They were I didn't say they were pretending to be a doctor. I just meant a more, a better rep. I wasn't pretending that they were a clinician. Yeah, just put the stethoscope on. Okay, we've got any more questions from our online audience?
Yep, so is it time to scrap the incentive model? in order to generate real change in behavior, you need to remove these do you need to remove these outdated reward measures?
Okay, can
You
we just
need
talk
to
about how big
change
the
them.
incentives
Yeah, yeah.
are and what people's understanding are of a rep's incentives? They're desperately low compared to most sales teams, right? That's the first thing to say, is it's capped, right, from my understanding. So I don't think it's a true incentive model. If you're into that, go sell photocopiers if they still exist. That's where the big bucks were, not repping. The most I ever got as a bonus was a small bump on what was an annual salary. So I don't know what that is now. I don't know.
Yeah, the code stipulates what the percentage of bonus can be versus salary, right? So the industry has a code of conduct that says it can't be all about incentives, right? So that's the starting point.
Yeah. So I'm not sure if, unless anyone else has a view on we're overly incentivized, I don't think that's ever particularly been an issue. The metrics, like the right metrics, yeah, they're wrong, but the sort of financial reward for meeting those metrics is not a massive. Getting up on stage and being number one, that's a much bigger incentive.
Do you think, and this is slightly controversial, do you think the code is right?
Yeah, I do. So I think it's,
you have to say that.
It's there. Well, yeah, but it's there to stop driving the wrong behaviours.
But surely that's more a question of what we're incentivizing and what metrics we're using.
And I think that's what the question is asking.
But I think that we should be incentivizing learning.
And that's it's one example of what you could incentivize. If you look at our incentive schemes, traditionally they would be the sales results that they're seeing at a territory level, and then sometimes some activity measures as well, right? And we've already talked about what you measure is what the reps will give you, so we have to be really careful, even if it's not a big percentage of their reimbursement, that what we put in there is what they'll go and do, so we have to be really careful about that. But then I do think that the sales is not all attributed to the rep, because increasingly it's complex what drives, and we saw in COVID some products had zero activity from reps because there was a lockdown, but we saw sales going up. And it just sort of proved what we've always known. It's not all about the rep. The rep absolutely, for me, has an impact when it's done in a really good way, but it's not all about the rep. So to put the rep's incentive on the sales, I think, is a challenge.
I agree. And I'm not sure I've got much more to say on that point. I don't know if anyone from the audience has a comment to that. No? Okay. Can we, any other questions?
Yeah, so there's a question from James, and he says, would the panel be willing to commit to a guess of when reps will be regularly using AI-driven tools to support the role? And then do such tools take over?
Okay, so there's a lot of tools that are existing, and it depends what you're talking about. So you've got AI or machine learning-driven next best suggestions, next best actions. You've got increasingly AI being used to listen in on calls, to assess the value of those calls, to see when buying signals or when objections are handled. I think that's a really useful learning tool to help reps improve what they're doing, but add value and not miss opportunities. But it all depends on...
AI coaching tools,
yeah.
Face-to-face.
Yeah, but in terms of AI and next best suggestion, you've got to have the good data to power those, and I would struggle to name any.
I think you've also got to have the hearts and minds, right? So people have to really buy into, is this going to be valuable to me, to help me in my role, and will it be valuable to my customers? Yeah. And I think there is still, I believe, some reluctance to fully embrace some of these tools, and perhaps, well, I've seen data recently actually where the average scores of kind of belief in these kinds of AI assistant tools was at best 5 or 6 out of 10 across the board. So it's much higher in head office teams, much lower in field-based teams. When you look at how those tools are actually used, about half of the calls actually did use these tools versus didn't. And when they were used, the calls ended much better in comparison to when they weren't. And the biggest driver of whether those tools were used was the rep's belief. So if you can get people to really understand the value and buy into it, they're much more likely to be open to adopt those tools into their daily, scheduling and how they and ways of working, but you have to get that hearts and minds piece first.
Hearts and minds, 100%, and even for more basic tools like the CRM in the first place, the iPad, sales aids, rep-triggered emails. AI for me is kind of all the way over here. Yeah. But you're absolutely right. There's the hearts and minds for any technology. It's not here to replace me. It's here to help me. And then showing the evidence that using it does help you. That's the most important thing is that. And there's an interesting AI company called Okra who we did some work with or we worked or collaborated on, where they talk about explainability. So it's not only do I believe this is going to help me, but why is this suggestion being made? And actually saying this is based upon the following and not some sort of, not generic, but an unqualified, you should do this next. It's like, why? Yeah. So I think there's the explainability bit and there's the hearts and minds, but I think it's even more basic than AI. So the question was, when will they regularly be using AI? Well, I'll tell you what, I'm going to wait till they're regularly using CRM and sales aids and rep-triggered emails. Yeah. And then maybe I can talk about when AI will come in.
We can leapfrog.
So next question is, are reps and agencies easy targets for criticism? And therefore, should brand teams and commercial operations take more responsibility?
Yes.
So we were just saying that it's a more complex...
And it will never change.
Who are the easiest to beat down is the people who aren't present, and field teams are very often not present in discussions because they're literally in the field. But it is this more, we talked about it earlier, more complex organizational cooperation that needs to go on across functions in order to put the customer at the center and to measure that and evaluate over time and prove evidence, and therefore responsibility is going to be more complex and shared. And absolutely, I think it's easy to pick on certain targets.
I had a national sales manager describe it as we're sending reps into a sword fight with a butter knife.
Hey, some of those butter knives are great.
But part of this is also about, rather than just delivering or developing and designing tools from a marketing function and then pushing out to the team, at the very outset, I think marketing teams should be really working hand in hand with the sales teams to actually co-create what it is ultimately they're going to be used. So they should be involved with shaping it. They should be involved with feeding into it.
With that agility, they have to feed in. That's why I say listening.
Absolutely,
what they learn has to be accounted for in the same way that money is accounted for. It needs to, be tracked and distributed beautifully across the company, just in the same way that money is done. And otherwise, you're absolutely right.
Co-creation is really important for a lot of reasons, and for brand teams that don't seem willing to do it, I often use the analogy of why do we do advisory boards with our HCPs? We do it for two reasons. One is to learn from them, but we also do it to get them excited about what's coming and to create champions in the clinical community. That's what we want to do with our field teams. Not only do we get insights about what works, and we get their feedback and input on the co-creation, but they're the ones that will head out into the field and be excited about the new tool that's coming, the new sales aids that are coming. There'll be equity and stake in that tool, and it will increase uptake and usage. Sab.
Hi there, Sam Kareem from The Fourth, and it's a slight bias to my question because I run a creative agency as well. But I think we talked a lot about channel, and touching on content and how the brand teams can arm the reps with better content. And I thought I was really interesting, Rick, with what you said around the driver of sales metrics was getting that one-to-one conversation with a customer. And I think the key thing that's changed is how we get to that one-to-one conversation. And it'd be good to get the panel's thoughts on what that content is. Because our perspective is that it's not necessarily product focused or sales focused. And
I would say it's definitely not product focused. That's the least inspiring kind of content, I would argue.
And so to your point, I guess at the start, Paul, around access, support, services, can pharma brand teams do more to look to solve customer challenges, create content solutions that will help with awareness, help with consideration, and open the door to the reps to be able to have better conversations with customers?
100%.
Yeah, but the briefs need to be better. So if your agency's given a crap brief, you're going to fulfill that brief brilliantly, but it's going to be the wrong thing.
How do we change the briefs?
Well, yeah, I mean, that's actually a very good question, because in a way you need to show what you can do as well, like, and what you can do almost when you are briefless. And that sounds like I'm asking you to be naked. In a way I sort of am, I guess.
I guess sorry, I'm hogging the mic a bit, but the follow-up to that is, if you look outside of pharma to B2B, B2C, and how there's investing more in brand building versus pure sales activation, like, when do you think us as an industry will look beyond and believe that we're unique in some way, and that healthcare professionals aren't people too, and aren't influenced by emotions and not just pure rational information?
I'm going to slightly off point, but you've triggered something, which is, I think when we ask doctors what influences them, they underestimate the power of the relationship with the representative. And Liv mentioned this, occasionally you go see a doctor and they go, it's good to see you, I'll do you a few, right? I'll do a few scripts for you, right? That's a light aspect of this, but that trusted source of information is really key. But I think you're asking, how do you get them into the funnel, if you like, and in pharma, is that funnel then the one-to-one at the end? Is that the sharp point at which that moving them from adoption ladder 1 to 2 to 3, or whatever we're talking about, from trial user to regular user? Are you talking about the funnel and what we do to bring them in?
Yeah, I think, yeah, and it was a leading question in that I believe that we need to do more above product and around product to help the delivery of medications to open the doors to have those more product-centric sales conversations.
If Elon Musk can get people excited about batteries, then we sure as hell should be able to get people excited about healthcare. We work in the most emotive industry of all, I would argue. We have absolutely no excuses, and there is so much potential for what we could be talking about, but we don't. So
I'm going to bring that bit to a close, because content's like a whole other discussion, right? I'm conscious of the time. So, is there any more? We got yes,
one
please.
last question.
Okay.
Hi, yeah, Mike, I work in the digital agency. So I was just interested to know what the panel thought. It's a big question, but in a simple way of explaining it, what do you think digital pharma really means in the context of this discussion?
I think it's a largely meaningless term. Everything's digital now. We're having this, not everything, but we're having this discussion about the PM Society's awards, just as an example. So there's 2 awards a year, one of which is the Effectiveness Awards and the other's the Digital Awards. But almost everything in the Effectiveness Awards has a digital aspect. It's like, I think digital's a misleading term in a sense. It's more about the touch points and channels, etc., and it's all a blend. So I feel that's why I'm not always sure there should be a digital lead or head of digital. It's kind of like you don't have a head of print, or it seems like an odd thing to me. What does it mean to me? It's about customer-centric delivery of high-value content across whatever channel they choose. And omnichannel is about that consistent journey. It doesn't matter what point you engage with that company. They know who you are, they know your needs, and they deliver the right content, engagement, and touch point, regardless of the channel that you're engaged with. I don't know if that answers your question.
I'd agree. I think to get digital to start happening, digital customer engagement to start happening, the industry ring-fenced roles, digital marketing, omni-channel manager, ring-fenced budget and said, you do it digitally, right? Just to get it to happen. Effectively, if you can do marketing without digital, you're probably doing it wrong. So I think we separated it out, and we need to now bring it back together.
Yeah. However, sorry, just to be controversial as usual.
Oh no, Paul.
Mark Zuckerberg would never have invented Facebook if he wasn't a geek in the first place. So there is a certain amount of investment that you need to make in becoming digitally aware, digitally savvy. Liv said in her opening statement that people buy from people, and that's only partially true. Like, I buy a lot of stuff on Amazon. and nowadays you probably do your online banking. People buy houses without talking to a person, apparently, now. So you have to actually, although digital should not be separated as a channel, you as an individual should invest in your digital awareness in order to be able to simply keep up with the future.
100%, and you need digital champions in organisations to push it through and to be the cheerleader for it and to make sure it's being done well, but it does need to be in every channel. Just to pick up on the Amazon thing, yeah, people don't buy from people, but it can work the opposite way. I try my hardest now not to buy on Amazon, because of Bezos and the way he treats his workers. Just saying, like, you know, and also that's not...
He's a person.
Yeah, exactly. But that's also not quite the same as a prescribing decision, etc. But anyway, let's not get into that. So we're coming up on time, and I do want to end on time. I want to thank the panel and for everyone asking questions, but I'm going to end with asking each of the panel to say a little something about if they were to give advice to people about the new roles that are coming up. I think we've all agreed there is a shift coming. There is an exciting opportunity. I think we're almost all agreeing there's an exciting opportunity if it's taken. But what advice would we give people in the industry currently in a sales role or in a marketing role looking at this? So I'm going to start with you, Adam, because you're at that end, and I'm at this end, which means I go last.
Okay, so maybe if I break up into two. So from a salesperson perspective, I've gone very loud. From a salesperson's perspective, I think don't be afraid of the evolution. I think it's very, very exciting what the potential that all of this data and new technology can bring. And ultimately, I think it's going to empower and arm you as a representative to have far greater potential connections with and engaging discussions with your customers. So that would be my advice to a salesperson. Don't be afraid, embrace it. For marketers, I think there's a lot still to be done to really, as I was saying earlier on, I think the mindset is absolutely key. If you and your company want to really move quickly within this direction, then I think there's still some work to do in terms of getting people to not be afraid, to not feel some impending threat to their role, to understand the needs of the people that you want to be using these tools, because remember, you know, a team of reps is often going to be very variable in terms of age, experience, technologically savvy or not, and so on and so forth. So it's important to get everyone up to the right level and make sure you're offering lots of support along the way, and very much get them involved with helping to shape whatever it is ultimately you want to do.
Yeah, I'd agree with that, really. I suppose for me it would be understanding where the fear is coming from. If it's a fear of just the whole technology versus human debate, then there's probably need to just get an early night and not stress too much about that, because that's just, you know, there's only so much you can control in the world. I think if it's a capability, I'm talking obviously from a Salesforce perspective, if as an individual they've got fears around their own capability of using the technology, of using the AI and the way things are rolled out, I'd say speak up and share that with, because I think the organisation as a whole has to take responsibility for bringing everyone along on this journey with them. And as we've alluded to quite a few times today, I think company culture is everything in this change. And if we don't get that right as an organisation, we're going to lose these, you know, some really good individuals who are these gold standard representatives that we want to take on this journey, and they're going to leave and go somewhere else. So yeah, that's, for me, I would say speak up as an individual, because if you're struggling, then there's a conversation that needs to be had.
I was a bit negative in my opening statement, you may have noticed. But what I would say is that with every negative or seemingly disruptive change, it's equally an opportunity. You know, as the world of digital rose, the new job of being a web designer was created. And now you would even argue that the job of a web designer is disappearing as we move towards different kinds of online activities. So if you're open-minded, then you can survive even industry-wide shifts, not even small tactical shifts. And I think that it's within each and every person to just remember and see the bigger picture and understand that the simple fact of getting medicines to patients has not changed and probably never will, but the way in which it's done will definitely change. That's an inevitability. So speak up and listen up.
Nice, yeah. So I'd go back to my opening statements about encouraging salespeople to do what only they can do, and that is to go and listen to the customers, understand their prescribing rationale, understand where the opportunity is, understand the decision-making units within the hospitals, and understand those personalities. But critically, they need to capture it and they need to be sending it in, so that then they can work with the brand teams to drive that digital content that's going to meet the needs of those customers that they understand so well. So yeah, that'd be my advice, is to really highlight the gaps of the digital content that they need, and to work with those brand teams to close that gap and really prove the value that they can bring into our industry.
Thank you. I would say anyone that's excited by the opportunity but is feeling unsupported and unloved in their current organisation, and they're just being told to get on with it, should be looking to work for those companies that will support them. To do that, speak to reps, do some research around those exciting companies that are doing the right thing, because the opportunity is there, but you need the support and the training to do it. And from the flip side, anyone that's looking at sales teams or content, got to win the hearts and minds of those field teams over to the power of data, technology on the channel, and how important they'll be as they're part of that mix. Right, so on that, I hope, positive note from all of us, I'd like to thank everyone online for joining us, and everyone, especially in the audience, for coming out, and so lovely to see people in person. And just a pitch for the next one, we will be looking at compliance in the digital age. We are here as a community to facilitate what I hope you've seen today is open, honest, unrehearsed opinion and discussion around these big issues. And the next one we'll be tackling is compliance in the digital age. So thank you, everyone, and have a good evening.